Hey everyone, it's Haley Arnold, and today we're going to be performing mouth care on the unconscious patient via the Kentucky Medicaid Nurse Aid book, aka the Bible. So we have our supplies right here for us, and all we're going to need is a pair of gloves. And since we're in the home setting, we are definitely going to be using our imagination here. So instead of our toothets, we have some Q-tips. We're going to need some chapstick. We have our emesis bin here, and a towel. So, before we get started, of course, as with anything else, we're going to knock on the door. Hi, Mrs. Jones. My name's Haley, and today we're going to be performing mouth care for you. And then I'm going to perform my hand hygiene and provide privacy for the patient. And then before we start to move the patient or anything, what we're going to do is we're going to lower the bed. But before that, of course, very important, we need to raise the side rails on both sides of the bed. So I got the side rails raised on this side, raised on that side. I'm going to lower the bed in a position that's comfortable for me so I'm not leaning over or tippy-toeing. And since I'm going to be working on this side of the body, I'm going to lower the rails on this side. And now before we start to move and reposition the patient, we're going to go ahead and put our gloves on. Now, for the patient, we want the patient facing us on their side. But before we do that, we want to go ahead and move the body in segments. And so what I'm going to do first is I'm going to move the lower part of the body away from me. Then I'm going to take the torso, move it away from me. Then we're going to gently roll the patient over on their side. We just want to make sure that their neck and everything is on the pillow and that it's comfortable. Then we're going to take our towel. We're going to put it underneath the patient's face and neck. And then at this point, we'll take our emesis bin and we'll hold it underneath the patient's chin in case there's any drool or anything, because unconscious patients cannot chew or swallow and we don't want them to aspirate, and that's why we put them on the side. Now for this next step, I'm just going to show you on myself how we would be cleaning the mouth. So we would take our first toothet and we would just clean the inside chewing surfaces on the bottom of the mouth. And then we discard of that. Then we're going to do the top chewing surfaces and the inner and outer surfaces. And we're going to discard. Now we're going to be doing the insides of the cheeks and the roof of the mouth. Please excuse my doggies in the background. And then we're going to be doing the tongue. And last but not least, we would take a sponge or something at this point to just kind of do like a nice rinse around the mouth, and then just rinse all around the patient's mouth. And once we're done with cleaning all the surfaces within the mouth, we would take our chapstick and apply the chapstick to the patient's lips. And then once we're done with all the care within the mouth, we're going to now go ahead and discard of our gloves. Now we're going to reposition the patient. We're just going to slowly roll them back over, making sure that their neck and everything is still in alignment with their body. And again, we move the body in segments. So we're going to move torso first, close to us. Legs, close to us. And then, now remember, the bed is raised at this point, so we're going to raise the side rails of the bed, lower the bed back down to its original position. Then I'm going to lower the side rails again, walk over to the other side of the bed and lower the side rails, because remember, whenever you leave a patient's room, you don't want the side rails to be up. And then we have our call light here, and we're going to place it within good reach of the patient. Then we're going to perform our hand hygiene again and report and record. And that's oral care on the unconscious patient. Thank you.